So, welcome back to the session, Doctor. So, you have the link over here, and I'm sure that you can be able to. Um, Great. Yeah, that's wonderful. Hari, Neeraj, Rahul, Tanuj Chowdhury, very good. Now we go to the question number 7. A 20-year-old man with sickle cell disease, with fever, pleuritic chest pain, and hypoxemia with a new pulmonary infiltrate. What is your diagnosis, doctor? The classical question. Yes. Can you send all the links to RP Gupta Mehta? Good. So it is the acute chest syndrome, a very easy question. Nice to see 17 online classmates. Sainath Reddy is on the top of the world. Now, the question number 8 out of the 40 questions. 61-year-old with crushing retrosternal chest pain, ST segment depression. Depression is a sign of ischemia. So, high sensitivity cardiac troponin is elevated. So, what is your diagnosis in this given case? Yes, it is non-ST elevation MI because of the elevation of the cardiac enzymes. Neeraj Nagar is on the top. Good. Good to see Priya, Uma Shankar, Pavan, and many more who are all online. Yes. A 56-year-old ECG shows ST elevation in 2,3 AVF. What creates greatest reduction in mortality? Very good. We need to do percutaneous coronary intervention. Good to see 20 online players. We are very popular now. So, Dr. Sainath Reddy is on the top of the game. 67-year-old diabetic with prolonged chest discomfort. Troponin is elevated. There is a T wave inversion in anterior leads without ST segment elevation. So, what is the differentiation between unstable angina and non-ST elevation MI? Great. It is the elevated cardiac troponin, which is a differentiator. We can see Neeraj Nagar typically added up with 15 points and coming to the second place. Excellent. Six-year-old intensive care unit with septic shock secondary to pneumonia. And urine sodium is 52, fractional excretion of sodium is 3.5%, and urine microscopy is showing numerous muddy brown granular casts. What is your diagnosis, doctor? Great. Only 7 of you correctly answered. It is acute tubular necrosis, which presents with muddy brown casts, is what you need to remember. A 45-year-old woman with resistant hypertension, recurrent episodes of muscle weakness, metabolic alkalosis with hypertension. Immediately you should jump and answer. Those 2 clues are enough for you to make the diagnosis, doctor. Yes. Very good. It is a case of Conn syndrome, which is primary hyperaldosteronism that lead to the development of the hypertension with metabolic alkalosis. Dr. Survi Gupta absolutely rocks. Nice to see Swapnil, Shakti, Tanuj Chowdhury, and many more who are all online. Good. A 36-year-old woman, severe headache, palpitations, profuse sweating, paroxysmal hypertension, plasma-free metanephrenes are elevated. That is the most important buzzword you need to catch in order to make the diagnosis. I'm sure all of you will be able to answer this correctly, more or less. Great. It is pheochromocytoma. 11 out of you correctly answered. Good to see 24 online classmates. Sainath Reddy is still rocking on the top. Very good. Now, doctor. A 17-year-old obese adolescent, progressive dark velvety pigmentation on the posterior neck and axillae, strong family history of type 2 diabetes. So, where do you see acanthosis nigricans, which is classically given in this clinical vignette? Good. It is the insulin resistance. 16 out of you correctly answered. Very good, doctor. Dr. Survi Gupta comes to the top. Excellent, doc. Persistent inflammatory acne involving the face and jawline, irregular menstrual cycles, excessive facial hair growth. I'm sure you will all answer this correctly. Very easy question. Yes. Good. Survi Gupta makes it to top once more by answering very fast. Type 2 diabetes, near normal fasting blood glucose, elevated postprandial blood glucose. So for postprandial hyperglycemia, inhibiting the intestinal carbohydrate digestion, this is a very easy question. I'm sure most of you might have answered it correctly. Good. Aman perfectly answered. It is the oglibose, acaribose, which you need to remember among the diabetic drugs. Patient started on enalapril for hypertension, has a persistent dry cough. What is the main reason for that, doctor, in anybody who is on ACE inhibitor? Angiotensin converting enzyme is also required for some other purpose. Shoot your answer. I'm sure all of you will answer this correctly. Very good. 7 of you correctly answered. Uma Shankar now reaches to the top. Excellent, doctor. Now, question number 18. 68-year-old with heart failure with reduced ejection fraction, stable on diuretic therapy. Giving which additional drug improves the mortality, reduces the mortality in the patients who are having congestive heart failure? Good. Excellent. Aman comes to the top. Once you introduce ACE inhibitors, it will improve the remodeling of the heart, is what you need to remember. 54-year-old with hypertension, type 2 diabetes with persistent microalbuminuria, but normal serum creatinine. Which antihypertensive is known to lead to slow the progression of the kidney disease while effectively controlling the blood pressure in the patients who are having type 2 diabetes? Very good. Aman comes to the top. Excellent. At an altitude of 3,800 meters, there is headache, nausea, fatigue, and giddiness. Which drug do you give to treat and also prevent the acute mountain sickness? A very easy question. I'm sure most of you correctly answered. Excellent. Once more, Aman is absolutely right. Even Survi Gupta rightly answered. Some of the questions will go very fast. After taking large quantity of paracetamol, she is currently asymptomatic. What is the antidote you want to give? Very easy question. I'm sure most of you correctly answered. It is the acetylcysteine which is being given. Excellent. So it is a fight with 40 MCQs in general medicine. Every day evening quiz we will conduct. Please tell your friends to join. So, very good. Good. We need to give IV sodium bicarbonate. Whenever salicylate toxicity is there, we need to alkalinize the urine, is what you need to remember. Good. Once more, Aman remained on the top for almost 14 times. Excellent. Patient has severe COPD, increasing drowsiness and worsening dyspnea. ABG is showing pH of 7.28, which is acidotic pH. PaCO2 is increased. So what is the acid-base disturbance, doctor? Very good. Aman, Uma Shankar, Suvi Gupta, Ashvi, and Sainath Reddy, everyone is absolutely right. Ten-year-old with growth retardation, recurrent renal stones, and persistent hyperchloremic normal anion gap metabolic acidosis. Urine pH remains above 5.5 despite the systemic acidosis. What type of RTA? This is a real wonderful question. If you answered it, you are a wonderful guy. You are ready with the general medicine. It is the type 1 only 2 of you could answer. Inability to acidify the urine is an important indication that it is type 1 distal renal tubular acidosis is what you need to remember. So most of you gone wrong. Only Aman could be able to be on the top of the world. Three-year-old fever, ear pain, irritability, decreased feeding for 2 days. Bulging erythematous tympanic membrane with reduced mobility. What is your answer, doctor? Let's see. Very good. Aman, Dr. Surbi Gupta has rightly answered. Ashvi also rightly answered. Excellent, doctor. Now, sudden onset of severe vertigo with nausea, vomiting, unidirectional nystagmus, abnormal head impulse test, but no focal neurological deficit. So, what is your diagnosis, doctor? Very easy question. Good. Aman rightly answered, and Dinesh also rightly answered. Beautiful. Abrupt severe rotational vertigo lasting more than 24 hours after a recent viral upper respiratory infection. Hearing is completely normal. Neurological examination may you have spontaneous horizontal nystagmus. So what is your answer? Very good. Aman, MSD, Dinesh, you need to know how to recognize the benign, vestibular neuritis after a recent respiratory infection. Recurrent episodes of abdominal pain, constipation, anxiety, tachycardia, and proximal muscle weakness. Which enzyme deficiency is responsible for this, doctor? Yes. So, Aman and Survi Gupta are very close in the game. Very good. Now, 30-year-old with fatigue, gingival bleeding, petechiae, abnormal promyelocytes, multiple OR rods, disseminated intravascular coagulation. Typically, in which condition do you get the DIC as a complication in AML? And what is your treatment? So, it is the acute promyelocytic leukemia where the ATRA therapy is given. So, Uma Shankar, I'm very proud. Ashvi also is right. Sainath is right. Excellent, doctor. 56-year-old with progressive hypoxemia, 24 hours after the septic shock. Perforation is there in the bowel. Peritonitis is there. Normal LV systolic function, but pulmonary edema. Typically, what is your answer, doctor? I'm sure most of you correctly answered. Excellent, Aman. Aman crossed 1,000 points. Survi Gupta is also trailing very closely. Excellent. Hypertension, diabetes, dyslipidemia with recurrent episodes of substernal chest pain at the rest, ST elevation, depression during the pain. What is your diagnosis? Very simple and straightforward diagnosis. So, Doctor, Survey Gupta scored 70, Dinesh made 86. 28-year-old, recurrent episodes of DVT without any provoking factors. Normal protein C, protein S, antithrombin 3. Genetic testing identifies a mutation where there is a resistance to an activated protein C. Which inherited thrombophilia, doctor? Factor V Leiden mutation. Only 6 of you correctly answered. Proud to see Aman is right, Dinesh is right, very closely. Dinesh and Survi are giving a threat to Aman's top position. Very good. The last 6 questions. 34-year-old, progressive weight loss, chronic diarrhea, oral candidiasis, generalized lymphadenopathy, CD4 count is 160. Plasma HIV RNA is elevated. So, what fulfills the diagnostic criteria for AIDS in this given case? Good. 8 of you rightly answered. Aman and Survi Gupta are closely chasing each other for the top position. Excellent, doctor. Now, 39-year-old with untreated HIV infection, with fever, progressive dyspnea, non-productive cough. Which opportunistic pathogen are we talking over here, doctor? Very easy question. I'm sure most of you rightly answered. Good. Aman and Survi Gupta, both of them crossed 1,000 score. Excellent, doctor. 45-year-old with the enlargement of the hands and the feet, increasing shoe size, excessive sweating, headache, progressive coarsening of the facial features. So what is your diagnosis? Very easy. Good. Aman has scored high. Now, last 3 questions, doctor. You need to answer very fast. The one who answers fastest get the bigger score. Central obesity, proximal muscle weakness, purple abdominal striae, endogenous hypercortisolism, and plasma ACTH is elevated. So how do you differentiate pituitary Cushing's disease from an ectopic ACTH secretion, doctor? So let's see how you have answered. Excellent. 11 of you correctly answered. It is a high dose dexamethasone suppression test, not the low dose, is what you need to remember. So very happy to see 26 players competing fiercely with each other in order to come to the top. Aman and Survi Gupta are maintaining 1246 and 1026. 63-year-old chronic smoker. Good to see 6 online. You can actually use that link or scan the QR code and join, doctor. So every day evening we are going to have one medicine, one surgery, one gynops, and one overall quiz where you can play anywhere in the country. Very good. Good. Almost Neeraj, Uma Shankar, Survi Gupta, Aman have crossed, and Ashvi is also doing very good. And Prabhasharan Singh, Sainath, excellent try. Now, doctor, the last two questions of the today's evening. 42-year-old with chronic fatigue, with weight loss, salt craving, dizziness on standing, diffuse hyperpigmentation, hyponatremia, hyperkalemia. By now, you should jump and answer. Answer is there before your eyes, doctor. It is the classical case of Addison's disease. Beautiful. So, Survey missed it. Oh my God. Uma Shankar, Neeraj, and Aman did well. The last question for the today's evening. Daily we have a medicine, one quiz at 6 p.m., surgery at 7 p.m., gynops at 8 p.m., and complete NEET PG syllabus at 10 p.m., 9 p.m. So 6, 7, 8, 9. Yeah, 4 quizzes. Take every opportunity to participate, doctor. 9 of you correctly answered it. And that's great. Wonderful to see Aman being the topper of the today's quiz, and everybody did good and great. I hope you all enjoyed the quiz. So please share this to all your friends, and I'm sure every day we meet and make it happen. Thank you.